Presenting first, we have Dr. Anna Stec, who is a professor of fire chemistry and toxicity at the University of Central Lancashire, with extensive experience and portfolio of research in identifying and quantifying toxic hazards in and from fires and understanding the factors that affect fire smoke toxicity.
Yep, thank you.
Without further ado,
Yeah.
Dr. Anna Stec.
Thanks a lot. Good morning, everyone. How on earth I'm going to deliver my speech after that presentation? I'm a scientist and I live in the UK, but originally I came from Poland, so I'm also Polish. And first of all, I would like to thank Alberta for this kind opportunity to give a talk and presentation. The only one thing that I can say, God, I'm jealous how far you are ahead compared to where we are. And I'm going to show you some of the work that we're doing at the moment in the UK and also Europe. So the title that I was asked to give was to look at the European perspective within 20 minutes. Well, European Union's got 27 countries. And one thing that maybe some of you are not aware, UK is not part of European Union anymore. We had Brexit in 2020. So UK is not part of the European, which kind of I'm also presenting today. Not to make even worse is that UK's got 4 devolved governments, which is Scottish, Welsh, Northern Ireland, and English. So each of that works independently, particularly if you look at the firefighters' approaches to their health and so on. So, I think that's for the next slide. Oh, I'll try that one. Oh, I'm going back. Oh, that's forward. Yeah. Right. So one thing that gets me is that while the firefighters' mission remained the same across the globe, working environments and conditions are really different between the countries. And the one thing that I came to is, within 20 minutes, what is the major thing that actually is similar within those countries? So, coming a bit to the science, with the most of the data that I'm going to present was commissioned by the Fire Brigades Union in the UK. And what you can see is actually some of the results are from the survey that we ran amongst firefighters in the UK. So we set up the questionnaire for 3 months, and we had around 11,000 firefighters responding to quite a number of questions. We were not popular because there was around 70 questions, and I know that firefighters like no more than 20. But what you can see is kind of diversity and the factors that might affect an increased likelihood of developing cancer amongst firefighters. At the bottom, you've got something what we call odds ratio. That's the likelihood of developing cancer. And on the left side, you can see different factors that are giving statistical significance, which are related to the higher occurrence of the cancer. So, if firefighter has longer term service in fire rescue service, the cancer likelihood increases. And that's particularly seen where the firefighter have 15 years plus. Similarly, something what was mentioned today, contamination, decontamination. Well, I know you're a lot ahead of us, but we just only learned on contaminants in the UK pretty good 6-7 years ago when we started that work. And the things that we learned is from the firefighters that the cancer likelihood increases when we don't have any regulations or procedures on contaminants. So, for example, if firefighters are coming back from the fire incident and they do not decontaminate their PPE, they're not separating dirty and clean PPE, they've got smell at the workplace, that's all contributing to the cancers that we can see amongst firefighters. And then we've got personal decontamination, which is also kind of responsibility that firefighter needs to pick it up, such as showering and removing contaminants, particularly from the open fires such as wildland. So the things that brought me to the discussion are really 4 things that kind of are similar within the Europe and UK. First of all, workforce and staffing. Obviously, it's directly relevant to the finances, but I'm not going to talk that today. I'm going to talk about the declining number of firefighters that are kind of going for and applying for the fire rescue service in Europe and in the UK. Work conditions, that's firefighters at work and contamination at the workplace, but also working conditions. And when I'm talking about working conditions, I'm talking about that's not me, about firefighters who are going to attend a fire incident, for example, not wearing any respiratory protection. Regulations, policies, what we've got in Europe and also in the UK. And one of the things I know that we're heavily focusing on the health monitoring and screening, but we cannot forget anything about the culture, and that was really nicely mentioned at the earlier speech, badge of honor, which I'm going also to show you some nice data, training, awareness, and so on. Right, we know that firefighters have higher rates of cancers. Interestingly enough, World Health Organization found direct link between firefighter cancers occupations, something what you knew for many years. Yet in Europe, for example, till very recently, firefighter risk occupation was not even listed as a higher risk. So firefighter occupation in Europe was classified as anyone who sits behind a desk. And if you go for the hairdresser occupation in the European Union, that was higher risk occupation simply because they're dyeing hair, which having a lot of carcinogenic substances. So within the European Parliament, where UK was still part of it, we started kind of having that open debate and discussion to recognize firefighter occupation as a higher risk. And I can gladly tell you that we did that change just a month ago, but I'll tell that a bit later. One of the increases likelihood of cancer comes from the exposure to contaminants. And you can actually specify me talking about contaminants. I had to change my vocabulary because when I started working in the firefighter sector, I was talking about fire toxicants, and I'm kind of doing fire toxicity. And then everyone's saying, well, don't mention fire toxicants because that scares firefighters. And actually, we shouldn't discuss fire toxicants. We should discuss contaminants. Well, I will partially agree that contaminants are not necessarily only toxicants that will have a harmful effect to a human. But within the last 4 years working in the UK, I'm talking now about fire contaminants. Well, really, if we're talking about cancers, we're talking about fire toxicants. And if we look at the exposure of firefighters, sadly, it's not going to change really massively because we can see a huge replacement of natural products with the plastics. And a very good examples, I can see a few sessions later on today, is electric bikes, we can see a very big spike in fires, at least in Europe, lithium-ion batteries, solar panels, and so on. And also chemicals, huge session on PFAS, perfluorinated chemicals, but do not forget that we've got also other chemicals that are added to the products, gas-phase halogenated flame retardants, which are also kind of, some of them are banned, some of them kind of proved to be pretty having a harmful effect on a human, and we can see definitely that also across firefighter sector. So we've got that increase of the plastic materials. We definitely can see increase of the severity of the fire spread, but we also can see much higher concentrations of those toxicants that are released. And the problem we scientists have is that we only testing chemicals that we learned that they are bad. So perfluorinated chemicals, they were introduced to the market many years ago, but we only learned about them because there is evidence and growing up evidence. And similarly, when we're trying to correlate firefighters' cancer to exposure to specific chemicals, we targeted only some of the groups of them. We know that there are thousands of chemicals released in a fire, but we only choosing the ones that we are aware of. So kind of complicated, yes, difficult, yes, but they are contaminants that are generated in every single fire. And when I'm talking about it, soot is a really good indicator. Soot is built up by PAHs, and someone might mention later that, polycyclic aromatic hydrocarbons, which many of them are classified as carcinogenic. There is no problem to find, at least in UK and in European fire rescue services, there is no problem to find soot in the firefighters' workplace or on their PPE or on their hands or face. So coming back to the first point, workforce and staffing. Sadly, we see a decline for the last pretty good 5 years in firefighter population. And if you look at European countries, UK is not part of it, but I added that in, you can see huge decline in firefighters. Interestingly, if you look for the majority of the wildland fires in Europe, Portugal, Spain, France, you will see much smaller or bigger numbers of the declining. And the other thing that is really kind of coming on agenda is changing the retirement age. So far, retirement age when we're talking about firefighters is more or less 60. But in Europe, some of the countries, such as Belgium, is trying to introduce 67. What the consequences might be for it? Well, from our data, we know that we can see a top peak of increasing cancer rates at 45 and really getting hit to 49 years old. That's when the cancers starting showing up in firefighters. Majority of them will go through the cancer when they are 55. So if we're increasing retirement age, kind of the question poses, how many firefighters actually will have to go and tackle fires? And particularly on a climate change, an increased number of the wildland fires will have lower number of firefighters going for and attending fires for much longer and being exposed also for much prolonged times. So, yep, quite interesting point to look at the increasing retirement age. One thing I should point it out, currently UK and European Parliament does not have presumptive legislation for firefighters' cancers. None of the countries is offering regular health monitoring for early detection of cancers. Having said that, one country is exception, and I'm going to say proudly that it's Poland, and I'm going to talk a bit later when I'm going to the cancers. Regulations and procedures. Anyone who's working on that in UK or other countries, because I know there are different speakers also from the other countries, if you've got any regulations on contaminants and firefighters wearing respiratory protection, please tell me what it is. Because in UK, we don't have really procedures that firefighters must wear respiratory protection when they actually going for the post-fire or any open fires. We've got when they're tackling the fire, such as, for example, Grenfell Tower fire, for those who heard. They're supposed to wear breathing apparatus, but anything in terms of dumping over and all of that, there is no requirement to wear that. And it depends on the brigade that is tackling it. So as you can see, within the regulations and lack of regulations, we can see still huge majority of the firefighters who eating and drinking with sooty hands, lack of the contamination procedures. 84% firefighters still do not wear any respiratory protection. And if we say in the UK, why? You've got habit, so culture, we are far behind that of changing the culture and awareness. But we also got nobody else wears it because I'm told I don't have to, I decided not to. So you've got this. And in Europe, really advanced countries for the protection of firefighters. We're looking at the Scandinavian countries, Norway, Sweden, and Finland. They are really, really proactive. And what you had is that in 1994, Norwegian actually introduced the guidance on wearing respiratory protection, particularly when you're looking on the knockdown or overhaul fires. And if you look at how it's influenced the wearing respiratory protection, you can see that pretty good before the introduction of the guidance. Majority of the firefighters, 80-90%, did decide not to wear respiratory protection. But after introduction, it's starting changing to 2010. You've got 80-90% of firefighters wearing respiratory protection. So introducing guidances absolutely make a change. And I know that you probably know that, but yeah, we don't have that yet. Culture and awareness. Oh, that's kind of small text. Apology for that. Badge of honor. Yes, we have that. And we're probably 20, 30 years behind you on that. Really interesting point. You can see that 64% of firefighters believe of badge of honor. But what is more interestingly is that 46% of firefighters who were questioned said, yes, there is badge of honor, but it's not me. It's someone else in my brigade, which kind of tells you the approach of firefighters to actually admit and tackle the problem. And for those who said, I believe that there is badge of honor, they were associated not only with the higher rates of cancers, but those were firefighters who also did not decontaminate, did not wear any respiratory protection when they were attending the fire incidents. They also had no regulations or procedures on keeping the workplace safe and healthy from the contaminants. So Fire Brigades Union follow up and based on the lack of guidances on contaminants. We had a pretty good guidance on asbestos, but we didn't have anything in relation to contaminants. They actually said, can you do a literature review worldwide on contaminants? Can you do that questionnaire, which I just kind of showed some of the data? And can you provide some recommendations what we should do? One requirement, it cannot cost, because fire rescue service is struggling financially. So we had to find somehow consensus without kind of reasonable assumptions, which would not cost. We've done it. It's publicly available. One thing that I should point it out is that that was released 2020, but we had Swedish best practice document, which was released pretty good decade earlier. So again, Scandinavian countries is something what we very closely follow up and looking as example. The good thing about the best practice, it's there. It's starting changing culture and awareness amongst firefighters. Amazingly, that was translated into 6 languages, which mostly in Europe. And even far more kind of advanced is that Polish government translated this best practice into documents and approved this as a mandatory guidance on minimizing exposure to contaminants. Recommendations, especially looking at the contaminants at the workplace, were implemented from January last year, 2023. So they didn't have to prove about contaminants in their country, because that's something what I really struggle in UK. So first of all, I was hearing UK is the best. We don't have problems with contaminants. We don't have problem with cancers. So when we starting saying, can we look at the contaminants? No, we are much, much better for that. So I spent 3-4 years going through the questionnaire, literature review, indoor air quality to show that there is an issue. And then 2 years ago, I found out, yeah, we were aware of contaminants. We knew that firefighters are exposed, but we don't know how much intake of those contaminants are, which kind of leads me to the second part of the project, health monitoring and cancer. But the Decon campaign is doing really well, and I can say that 98% of fire rescue services in the UK actually improved their facilities and improved their approach towards contaminants, so it really works. So where are we up to with the cancer? Because I know that this presentation is supposed to be on cancer. Where we are on the cancer, EU introduced the first presumptive legislation law, 1982. That's bloody a lot of time to catch up with us. Followed by Canada, Australia, and I know that there will be some speakers from Canada later on. Poland. Poland was really interesting in 2019 because they said, we don't need to reinvent the wheel. We will just follow what US did, and we will introduce presumptive legislation. They did. They did for cancers and diseases. We've got first European member state that introduced in 2019 presumptive legislation for firefighters' cancers. At the moment, the work in Poland is on looking at the health monitoring. And then 2022, World Health Organization, as well as you know, introduced and provided direct link between firefighters' cancers and and occupation. In Europe, European Parliament, well, we try to talk about increased risks and occupation of firefighters in Europe from 2017, and I'm really glad to say that in October 2023, we had a mandate that European Commissioner is going to create a guidance that every single firefighter should have a mandatory training and awareness on decontamination. Keep in mind that this kind of directive is under asbestos, and you just say, well, asbestos? Yes, but it's opening the door. Once we've got that guidance, it's opening the door for contaminants, everything else that's not asbestos. And then February 2024, yes, we did it. There was a voting in February, so just now, this month, first week, where we, under the directive of carcinogens, mutagens, the IARC, World Health Organization report, was approved, accepted and acknowledged, which means that according to European Union law, now firefighters have occupational cancers. It is recognized. What are the consequences? Well, in Europe, every single member state will decide what to do with it. European Parliament cannot put and force to do anything on it, but it says that each member of the state needs to tackle it and needs to address the issue of firefighters' exposures and cancers. So, pretty good step forward. What we do at the moment, well, in the UK, again, Fire Brigades Union, initiated and funded our university to test 1,000 firefighters across UK, which we just completed. And we collected blood and urine to test for 63 clinical markers for cancers and diseases. And we also test blood and urine for fire effluents and metabolites. What we're trying to see is how firefighters are exposed to contaminants, but also to see if there is any link between those exposure to contaminants and cancers. At the end of that, we also want to develop health monitoring package for the UK firefighters. Why I'm saying UK? Because if we're trying to compare this to the US, and I will just give example of the wildland fires, we not necessarily have wildland fires in UK. We've got peat and grass fires, which toxicologically significant is really different from the fire emission perspective. Personal protection equipment, completely different. Practices, approaches, culture, behavior, really different. So we really need to target it. Types of the cancers which are also different in UK compared to the UK. However, similarities between the cancers are we can see dominance of the skin, digestive cancers, similarly as worldwide data. One thing that I'm kind of going very careful is anywhere I'm going on the conference, I'm just saying, can you compare the cancers between different countries? Well, we can definitely state there is a higher occurrence of the cancers, but we cannot compare data to data because how the data is collected, how the data is generated, the factors that will affect those cancers is really, really different. So we need to be extremely careful how we collect and analyze the data. And that brings me to the conclusions. Well, first of all, really amazing experience because I was kind of a member of the IARC and World Health Organization, and I learned one thing. In order to really lead the changes and really recognize your work as a firefighters, we need to work together. There is really no point to work on its own for its own target. And the way that we can do it is through today's meeting. Knowledge sharing, global collaborations, and also nice drinking in the evening where we can entertain a bit ourselves. And on that point, I will thank you for attention and pass it to the next speaker. Thank you.
We are so fortunate to have the fire service, Professor Anna Stec, with us. She is a chemist, but as you can see, an incredibly passionate and ardent supporter of firefighter cancer prevention. So thank you, Professor Stec. Thank you. Okay, we're going to pivot now. We were in the European Union perspective. Let's go down to Latin America. Our next speaker is Dr. Mauricio Chang Salazar. Dr. Salazar is a renowned head and neck surgeon with an esteemed background in medical training from the University of Chile, who plays a crucial role in the head and neck surgery oncology unit at Guillermo Benavente Hospital, and coordinates the oncology unit for head and neck surgery and skin cancer at Clinica Sanatorio Alemán en Concepción. In addition to his medical achievements, Dr. Mauricio Chang Salazar is a dedicated volunteer firefighter, a commitment that he has upheld for the last 28 years, serving in various capacities across Chile. He currently serves as the Chief Medical Officer for the Urban Search and Rescue Firefighter Group of Chile and imparts his knowledge as an instructor in the rescue areas of National Firefighting Academy. And as on a personal note, as you all may know from reading the news, that Chile has just undergone a couple of different wildland fires. And I was texting with Dr. Chang Salazar, and he's like, yep, I'm in a fire right now. He's like turning off a fire. This is an amazing individual. Please join me in welcoming to the stage to give us our Latin American perspective, Dr. Mauricio Chang Salazar.
Thank you. I had some notes. Okay. The cancer is scary for all of us, for the doctors, for the person, for us like firefighters. Cancer is, in firefighter, is a global health problem that makes no difference between men, women, professionals or volunteers, not even between nationalities or specific regions. Latin America is a region made up of a group of countries where the dominant language is derived from the Latin, from Italia, Roma. Do you remember that? It has a population of 700 million people, and one of the most characteristic elements is poverty and income inequality. In this area, 1/3 of the population does not have access to health insurance, and 43% of the population under 14 years live in poverty. Oh, sorry. In Latin America, we have like 1.5 million of firefighters, which share the same socioeconomic pattern, and especially among the volunteer firefighters who have the same limitation from the health access. The majority of the firefighters in our region are volunteers, but we also have professionals firefighters in almost every country, and others belong to the police of military. I come from Chile, a long and narrow country located in the southern cone of America with about 6,500 kilometers of long and 20 million of inhabitants, many of you know for his attractions, like the desert of Atacama, no? The Moais of Easter Island, the Torres del Paine. Do you remember that? The rescue of the miners in Chile, and Pedro Pascal now. But many, you know, the tragic history of Chile, being one of the countries most prone to natural disasters in the world. Here, you can see the Calbuco eruption in 2015, the earthquake and subsequent tsunami in Valdivia in 1960. This earthquake has been the largest since record began, and if we look at the top 10 earthquakes in the world, Chile ranks third of this list. The Valdivia earthquake and subsequent tsunami in 1960 killed people as far away as California, Alaska, Hawaii, New Zealand, and Japan. Recently, we have the death of the former president, and if you see the news, one of the deadliest fire in the story in Viña del Mar, with more than 200 dead or missing. Everything is happening in Chile. And all this emergency has been handled by Chilean firefighters, an institution that it's more than 117 years old and had some 15,000 firefighters through the country, 100% volunteers. But let's go back to America Latina and see what's the reality of our fighters in terms of our firefighter in terms of cancer prevention. Oh, sorry. If we analyze the research data on the topic at the regional level, we will surprised to know that the published work are scarce and often have very little impact. Here we have two published works, one of them gathered by Dr. Cava Martinez in Dominican Republic, and another carried out by the University of Concepcion where I worked last year. If we talk about the specific prevention programs, the picture is even darker. And the lack of campaign at the Latin America level is disturbing. Only the Santiago Fire Department with 22 stations created a cancer prevention plan in 2022 with a specific measure and dissemination campaign. Unfortunately, maintain these measures over the time require financial investment, personnel, and time. This is a campaign just in one fire department. As regard for about 5 years, I have trained multiple fire departments from Chile, Argentina, Paraguay, and Colombia in cancer prevention. However, beyond an explanatory class, the real impact of these activities is minimal. As I said, except for the example of Santiago de Chile Fire Department, there are not institutional policies. The American Firefighter Organization, OBA, developed a helmet cleaning course available in his website. However, great commitment is required from the authorities. We have not planned to long term. So, sorry. Oh. As I said, for example, after content search already said that we are very far away. Therefore, we have to duty to ask ourselves with today, why today in 224, with all the information available with so much evidence, the fire of Latin America have not put the cancer prevention among our priorities. Why? The resources or problems, the money. Without detracting from the previous ones, we always have the cost of I'm not interested. Perhaps firefighters as an institution do not believe that cancer prevention is a priority, at least not today. So if we look at Latin America from this perspective, it's absolutely understandable that there was not a representative from our region in the 2022 working group of occupation experts as the firefighters. So why happened that? So we have to know where we are. We have to know why we are here. So we make a survey. The first aspect to evaluate was the work time, therefore exposure that our firefighters have, and we see 25% of them dedicate more than 22 hours per week to the service. In our case, many young firefighters, students, live in the fire station, therefore they dedicate every night to service. In my case, while attending medical school for 7 years, I live at the fire station. 73% of the fire department do not have discontamination procedures at the fire essence, but firefighters and their equipment are transported without cleaning or decontamination inside the cabin of the trucks or personal vehicles of the firefighters. 66% of fire departments do not have procedures for decontaminate equipment and uniform after the fire. What happened with this uniform? They are used again by firefighters, loaded with contaminant over and over again. 63% don't have protocol to prevent cross-contamination within the stations. 18.4% the fire station don't have personal transfer rooms and therefore contamination limitation within the common areas of the station. Even today, there are stations where firefighter uniforms are found at the foot of the firefighter beds. When we look at individual action of firefighter, we can find that 34% transport their dirty uniform in their private vehicles. 37% do not have facilities to decontaminate their equipment at the station itself. 24% of firefighters must leave their uniform in common area, bedrooms, rest area, dining room, etc. 24% use their uniform without cleaning for activities within the station, such exercise, academics, of meetings. So we asked our firefighters if they believe the measures should be implemented to reduce the risk of cancer at the national level. They respond with a categorical 93% that these measures are very necessary. And here, for the time, an interesting aspect also appear, which is the firefighter's self-criticism, which seems very important to us. If you observe 35% of those survived respond that there is a lack of individual interest in recognize the risks and protecting themselves. Furthermore, 55% believe that there is a general ignorance of the part of firefighter about the risk of cancer. So, if we don't know, why would we care to take measures to protect ourselves? With this information, I made several calls to my authorities. I come to the OVA. I reached to the organization, OVA, exposing the lack of regional policies on cancer prevention in firefighter. After some conversation, we already have a commitment to start a prevention program. What we are today, we have to already left the space for the issue to be discussed in the next OPA General Assembly. We will work to create instances of risk awareness through the dissemination material and the training of monitors. We will be able to evaluate this result in the medium term with better tools that we already have. Why not next year we will present in the same symposium the progress we have made in this period. We have that commitment. Finally, on a way of conclusion, Latin America has a heterogeneous universe of firefighter where prevention has not been a priority. It's time to raise awareness and initiate prevention plans at the regional level. We count on our commitment and we expect your support. Thank you very much.
Thank you, Dr. Chang. Next up, we have Dr. Tracy Kirkham, who is an assistant professor at the Dalla Lana School of Public Health at the University of Toronto and a senior scientist and associate director of the Occupational Cancer Center at the Ontario Health. She has an MS in Occupational and Environmental Hygiene and a PhD from the School of Population and Public Health at the University of British Columbia, where she investigated cardiovascular risk factors among career firefighters. Since her PhD, she has been involved in 5 firefighting exposure and epidemiology studies. She was also a working group member of the exposure assessment of the IARC monograph, volume 132, and organizer for the recent Firefighter Cancer Research Priorities Workshop held in Ottawa, Canada. Please welcome Dr. Tracy Kirkham.
Thank you. I will today I'll do a little bit of a different angle than the other 2 presenters. Recently, so last year, we held a workshop, as Natasha mentioned, in Ottawa, where we talked about, it was as a workshop to discuss priorities for cancer research and firefighters for Canada. So I thought what I would do is present the findings from that workshop. So this workshop was really driven by a couple of factors. One was in 2021, the Canadian government enacted the Firefighter Action Plan. And this plan was to try to reduce firefighters' exposures to flame retardants through restrictions through commercial products. Then in 2022, in January, there was a bill put forward to the Canadian government to reduce firefighters' exposures and reduce firefighters' risk to cancer. And that has now become an act. And of course, I wrote it down on a piece of paper that I left at my desk, but I think the formal name of it is the Framework for Reducing or Preventing Cancers Linked to Firefighting Act. And then those are and then also the release of the IARC monograph, which showed an increase from a 2B to a class 1 carcinogen status for working as a firefighter. So these were kind of the drivers for this workshop. So this workshop was small, well, relatively small, around 70 participants. So have a good workshop where you have a lot of collaboration, you need to have it at a fairly small size. So this 66% of the people were in person, and the remaining were in a virtual, so it was a hybrid model. 17% of these people were international guests. So this was about Canada, so the focus was really on Canadian researchers and stakeholders, but we wanted to bring in some international perspectives to help Canada think about what we can do, so learn from their challenges and wins. And 15% of the workshop attendees were actually members of the working group from the last IARC monograph. And although this was focused on research for Canada, So we had a lot of researchers. It was very important also to include a lot of the stakeholders. So 35% of the attendees were firefighter representatives. And this included representatives from both the union and the management side of firefighting, and included representatives from the military, municipal firefighters, volunteer firefighters, wildland firefighters, and I can't read because I don't have my glasses. I can't read the last one. But anyway, a wide range of firefighter representation. So from this, it was a 2-day workshop. The first day was a lot of lectures, giving feedback and international perspectives, and the second day was all breakout sessions to have discussions about priorities. Through this, we came up with over 500 different gaps that were identified through this workshop. And what we did is we went through all the notes and we kind of combined them into 10 different themes. So I'll go over each of these themes, and they fall into 4 larger categories. So the first theme and major category was underrepresented populations. This was the largest discussed point during the workshop overall. Now, and I'm probably going to say this 10 times, most of the literature is on white male career firefighters. And it's not that we don't think you're important, but there are a lot of other groups that we have no information on. And so it's really unsure if what we know about firefighting is based on the white male firefighter in the career service. How does that impact the risks of others? Like, is it generalizable to the other groups? So some of the big groups that were mentioned were like non-white, so other ethnicities, and also female firefighters, for example. But not just on physical characteristics, but also on different types of firefighting. So we know about career firefighters, but what about volunteer firefighters? Their situation is different. Their access and resources might be different. Also, wildland firefighters was probably the second largest thing that was discussed at our workshop. At least in Canada, we have a very large wildland firefighter population. It's a big issue in Canada, especially in the last couple of years. We've had a lot of devastating fires. So understanding their exposures and risk is a bit more challenging, especially due to the seasonality and the transient nature of these workers. And the other thing is the non-suppression jobs. So a lot of these things are looking at exposures during suppression, but what about the other jobs in firefighting, such as fire investigators or fire prevention officers? There's a lot of other jobs out there. Even wildland firefighting is looking at, you know, the pilots, the truck drivers, the other jobs, even the cooks that work out at the camps. There's a lot of different aspects to firefighting. So the next broad group is looking at health research studies. And this is broken into 4 different themes, probably the more traditional things that we think about. So the first one is epidemiological studies. So a lot of the epidemiological studies out there have focused on the white male career firefighter. The reason for this, though, is not that they want to exclude women or non-white groups. It's mostly due to the fact that there's few of those people, at least historically, in the cohorts or in the population of study. And so then they get excluded from analysis because there's just too few of them to include. Now, hopefully with recent changes, with the increasing number of women and non-white ethnicities working in firefighting, we can try to increase the looking at that. So we need to increase the size of these projects in order to have enough numbers to look at those individuals. We also, a lot of the studies in epidemiology focus only on measuring exposure as ever, never a firefighter. Some studies do a little bit better by including duration of exposure, or duration of employment, not exposure, but very few look at anything regarding exposures. So we need to improve on the exposure assessment part to inform on epidemiology so we can look at dose-response relationships to give more concrete evidence on the risk of cancer on firefighters. Lastly, a lot of the studies do not account for some very important confounders. So personal factors such as lifestyle factors, such as smoking and diet. We know that these are very important, especially with the risks of certain types of cancers. But also another thing that's really unknown is or accounted for is secondary jobs. So a lot of firefighters, at least in Canada, work a secondary job. Because of their shift schedule, they have a lot of free time, so they usually work a lot in trades. And so not accounting for those exposures really muddies the effect of what we're seeing. The next gap is exposure studies. So there are exposure studies out there. However, most of them are really small in the number of exposure samples taken. And they don't cover the breadth of exposures known that firefighters are exposed to. So we need more studies. We need more studies so that we can get exposure measurements by different firefighting characteristics. So it's just different firefighter types, different firefighting services, so like municipal versus wildlands versus aviation, for example. Because these different types of firefighting have different compositions of smoke and may have different exposures. So we look at aviation firefighters, for example, their exposures to foams might be a lot higher. We also don't know how exposures differ by gender. Women work differently than men, and how they approach work may change their exposures. Also, with regards to the issue of how PPE may fit women. We also have a lack of information about, well, people thought that we have a lack of information about how the exposures in the air get through and all the way into the internal dose and what influences those things. So we need more information about that, especially a lack of having rapid testing methods for biomonitoring was really something that was raised. Next, we have the mechanistic and toxicological studies. So a lot of the studies have focused only on 5 of the 10 key characteristics of carcinogenicity. So we need more studies on the other 5 that weren't tested, as well as chronic inflammation, which is one of the studies, one of the characteristics that was studied, but there was still lacking a lot of information. And as I mentioned before, most of this is also, as not surprising, on white males. So we need to know how this differs for other groups. The other thing that was mentioned was about timing of sample, especially for biomarkers of exposure, biomarkers of effect is very important. And especially a lot of consideration needs to go into this when we're thinking of wildlands firefighting, because access and duration of exposure are much more complex. Then we have intervention studies. So there's surprisingly few intervention studies looking at the effectiveness of controls that are existing already. So we need more studies of that. We also need studies to come up with new creative, innovative ways to control for exposures, especially in some situations like wildlands firefighting, where traditional municipal firefighting gear just isn't applicable or possible for these individuals. We also need more information about personal protective equipment for females or males of different builds, and also for certain exposures. So a lot of the exposures are focusing on fire-related exposures, but we know that there's non-fire carcinogens that firefighters are exposed to. And we recently released a study looking at the risk of cancer among paramedics. It's the first cancer that we know of that's ever been published. And interestingly, in the same cohort of people, we saw that the risk of certain cancers were the same among paramedics as they were among firefighters. So this is suggesting that it may be non-fire related hazards that are causing this increased risk of cancer. And one of these was, some of these were looking at prostate cancer and I think it was skin cancer. So things like UV light and shift work are something that we need to also consider. The next 2 categories are based around behavior and communication. This was surprisingly a large topic, and that is, understanding behaviors is needed in order to know about effectiveness of controls. We see that the firefighter culture has changed over time, and it is improving, but we still don't know what are the barriers and facilitators to people following controls, so adhering to controls. Not only on the firefighters, but what about the services? What is it that's making their decisions on whether or what to implement as controls? Because it's not just on the firefighters here, it's also on the services. And you know, what are the different methods that we can use to change the firefighters' culture? What kind of training methods are needed in order to get through the awareness and the training to make them adhere to these controls? And then this leads to knowledge translation. So it's extremely important. It doesn't matter how good our research is. If we don't translate it well to the firefighter community, it's useless. So in order to do this, it was clearly written in our report and during the presentations that it requires buy-in from the firefighter services and unions, not just the services, and that they need to be involved in the project from inception all the way through to conclusion. And this includes, you know, when we put forth these recommendations to work with the fire departments and unions to see what is actually feasible. Because we can put forward great results, but if the firefighter departments don't give back to us and say, this is great, but this is not actually feasible, then we can't do anything to help you. But if we have this back and forth conversation, then we can work on how do we come up with adaptations to these controls so it will work for more companies. And you know, this is also about producing common language summaries and not just scientific research. So the last group is about data management and governance. Now this group we felt didn't fall really under research because a lot of these things were more the responsibilities of government or the firefighting communities to enact, but we would benefit from these, and there are some aspects to this that we could contribute to. So this really falls under 3 different groups. It's data collection and data resources, governance and governance action, and then health surveillance and screening. So the big thing here is there's a huge lack of exposure data and data about the employees. And this is not centralized, nor is it harmonized. So having this would really be beneficial for both the fire departments and also for research. And then the other large thing that came out was about harmonization and a national oversight for things like regulation, compensation, guidelines for the fire departments. In Canada, this is done on a municipal level, and it varies widely. So we do have cancer presumption in Canada in most provinces and territories, but the number of cancers that are covered varies widely by province. So they want a more standardized approach to this. And then also health surveillance and screening. So they came out to have 10 different priorities that were the top priorities for cancer research, which I won't, due to time, won't go over, but there were 4 that were identified for Canada in particular where we're well suited to do the research. One of those was looking at studies investigating understudied populations. We do have a growing population of female and non-white males entering our workforce. If we're able to get large enough studies, we have a great health system, which allows us to link to people quite easily. So we are an opportunity to do that. And we do a lot of large linking studies already. Next is studies investigating exposure interventions. So we have researchers and we have a lot of access to fire departments in Canada with good relationships. Will give us an opportunity to step in and do this. We particularly wanted to focus on wildland firefighters and female firefighters with this, in this group. Next was studies measuring exposure and improved exposure assessment for epidemiological research. So as I mentioned, we have a lot of exposure scientists in Canada. We do measurement data and have the lab infrastructure to do this. So it's to increase the number of samples here so we can come up with exposure assessment methodology or more information about characterization to give to epidemiology research. And lastly is the mechanistic studies on firefighters, looking at the other key characteristics of carcinogen, and then also, and I forgot my notes because I'm going to forget, it's the genotoxic effects for looking at passing this on to their children. And I think I'm out of time. So just if you want to review our report, it's written there, probably much more eloquently than I can present it here in 15 minutes. But this is the link to our report. It's a 65-page report, so feel free to access that and contact me if you have any questions. And just wanted to thank our organizers for the workshop. It was co-organized through the Occupational Cancer Research Center and Health Canada. And then, of course, we had a large team of people who helped with note-taking and report writing. And then lastly, of course, want to thank the participants.
All right. Thank you, Dr. Kirkham. So we'll open it up now for just a couple questions. We have people walking around with mics. We also have stands up here if anyone has any questions.
You're welcome.
Good morning. I'm Diana Matty, Fire Chief for the City of West Palm Beach. Good morning to all of you. I have a question about hair. Are there any studies, is anybody doing anything looking at, we know we're supposed to shower after a fire, but I know that even in a training burn, because I'm in an office now, I don't go in fires any longer, but I do have a long ponytail, and I know that that sticks around a lot longer than maybe it does on our skin. Are we looking at how long it stays in our hair?
Not that we are aware of, but there are a lot of additional questions to that in terms of showering temperature of water, how long, and what type of detergent to use, particularly with the shampoo and soap and so on, but not that I'm aware of any studies on that.
Good morning. Thank you all so much for being here. I'm Rochelle Hamlin. I'm one of the family medicine physicians with the San Antonio Fire Department, and I work at the Retiree Health and Wellness Center for retired firefighters too. One of the questions that pops up with our guys and gals is that we do see a bunch of cancer in them, but particularly in our retirees. And as your research has shown, many of our guys and gals are getting cancers in their 40s and 50s and after we retire. Our firefighters don't have coverage as retirees, unfortunately, in Texas. And many of our firefighters are concerned that with some of the research coming out, if we see that there's a temporal relationship between cancer and time and service in the department, are they going to be forced to retire early before they get the cancer and thus not get coverage? Or is insurance and like life insurance going to deny them because they're firefighters? Like, what would you give or recommend to our firefighters to kind of ease their minds about, hey, is this risk for cancer going to put me out of a job when I'm 20 years in?
Oh, that's for me. You're from the US. You can take that one. Right. I would say that the idea is to introduce regular health monitoring for cancers and other diseases, and therefore they can be detected early enough. So I would say at least what we're trying to achieve in UK is to provide that health checkups. At the moment, the majority of the firefighters that we identify with the cancers, they are diagnosed at the terminal stage. A lot of them with the metastasis, with only few months left, and very poor recoveries for those who've got a bit longer. But generally, we are kind of at the extreme that the cancers detected are far too late. Within the age, pretty good when we look at the Scottish data, at least, we can see 15, 20 years earlier compared to the Scottish population. So if we can bring and introduce, culture change, habits, procedures or kind of guidances, together with the health monitoring, that might kind of put that assurance that, it will not put firefighters out of the job.
And I would add to the conversation, too, about not thinking exclusively about length of time serving as a firefighter, but all the other factors, really, and the details that go into serving as a firefighter. Because you may be at a station that has very few runs, right? And so looking at other variables like number of runs and severity of fires that might be more nuanced and, get to the question of cancer risk would be things to consider.
Yeah, and I would also add, at least in Canada, we have presumption for a lot of cancers, and it doesn't matter when you're diagnosed. If it's after retirement, your work exposure still counts. So even if it's a cancer that's not covered under presumption, you can still apply for compensation. So maybe working on the compensation or pushing the compensation system.
Absolutely. Thank you so much. Would love to have those conversations more. Appreciate y'all.
Thank you.